Yeah, good advice.
Yes, well now it is time to ask the expert. As you may know, the flu season continues, and it seems like a pretty powerful strain this year.
Dr. Jennifer McKinnon of the Medical College of Wisconsin joins us now with what we need to know to stay healthy. So how bad is the flu right now in Wisconsin?
Right, in Wisconsin, it actually has a very high prevalence throughout the entire state. It's difficult to say the exact numbers because the testing of the flu isn't always done when you go to see your doctor, because a lot of it is a clinical diagnosis. So the numbers for this season aren't officially out, but it's important to remember that the flu does cause in the United States about 200,000 hospitalizations a year and is a major cause of death in the United States.
So when we talk about the strain this year, it is different. However, is the question I want to ask is the strain that is in the vaccine the same?
Right. So a lot of patients I've seen in my own clinic have had tested positive for the flu, even though they did get the flu vaccine. It is frustrating. The flu changes. It's a constant mutation. It's a very complex virus with over 200 strains. So it's important to remember that even though they didn't get it exactly right, 2 out of the 3 strains are covered this season.
So it's still
so
a
it's about
benefit.
50% effective.
Okay. And there's no time, I mean, people can still get the flu shot now. Do you recommend that?
Right. Even though the major strain going around happens to be one of the ones not in the vaccine, like I said, we're still saying it's about 50% effective. There might be cross-reactivity, so that if you do get that vaccine, it will help boost and cross-cover and form antibodies to cover the strains we're seeing the most of.
Okay. Because I think some people think it's so late in the year, I'm not going to
why
get
not
one,
even do it?
but really?
But
Yes.
if you're not into the flu shot, because there's some of us, you can still do the nasal.
Right, the nasal is from ages 2 to 49. It is a live vaccine, so definitely if a person has like comorbid conditions of immunocompromised states or on different immunosuppressant medications that fight their immune system, they really would not qualify for that. But certainly ages 2 to 49 could talk to their doctor about the nasal spray, so you don't have to have a shot.
And I guess just overall, little things we can do. Everyone talks about washing your hands and
Yes.
covering your mouth. I mean, is it any other things we should know?
It's just
or?
polite.
Yeah,
Yeah, I know, right?
Yes,
But
carry
you'd
your
be
hands.
surprised when you're in public how many people you see just sneezing all over.
Yes, definitely carry hand sanitizer. Definitely, if you are sick, try to stay home from work. The flu is, of course, extremely costly across the country for people missing days of work, but you really want to stay home for at least a day after that last fever. And a lot of times you might not even have symptoms of the flu, but you're still infected because it does take a good day to ramp up. There are medications that you can take, especially this year with the flu vaccine not being as effective, to prevent full-blown flu, where it would limit the course of your illness by about a day. And you can call your doctor if you know somebody in your office or whatnot has the flu, and they can start that medication for 5 days.
Interesting.
Not bad.
Okay. Well, thanks so much.
Yes, thank you. If you have a question for our expert, you can always email them at asktheexpert@today'stmj4.com. You can also leave a voice message at the number you see on your screen, 967-5253.
And